Are you feeling anxious about performing a cranial nerve examination? Or maybe it's part of your upcoming clinical exams? Well, don't worry. We're here to help you gain confidence with one of the most integral parts of the neurological exam. Let's start from the beginning. What are cranial nerves? The cranial nerves are 12 pairs of nerves connecting directly to the brain and terminating at various locations throughout the body. Each nerve has a number, generally written in Roman numerals, as well as a name relating to its structure or function. The 12 pairs of cranial nerves are named for their position in the longitudinal axis of the brain. That means cranial nerve 1, or the olfactory nerve, originates from the olfactory bulb at the anterior of the brain, whereas cranial nerve 12, the hypoglossal nerve, originates from the medulla. The bulk of the cranial nerve exam will be taken up by assessing the function of each of the 12 cranial nerves, with some being assessed together, such as 3, 4, and 6, and the 9 and 10. For more detailed instructions on the assessment portion of the cranial nerve exam, check out the links in the description box below. A cranial nerve exam is a structured examination which is part of the full neurological exam. It's designed to check each cranial nerve in turn using a variety of methods which can usually be completed with equipment that is readily available in a hospital environment. The cranial nerve exam requires training and skill to perform correctly. As such, only qualified healthcare practitioners or trainees under appropriate supervision should perform this examination. Like with any clinical examination, there is some variation in how you choose to assess each of the cranial nerves, but some things should remain constant every time you conduct a cranial nerve exam. Tip number 1, use an acronym like WIPE to remember some key actions to take before commencing the cranial nerve exam. Wash your hands, introduce yourself, double-check the identity of the patient, ask permission to examine them, check if they have any pain, position them for the exam, ensure privacy, and expose the head and neck. Tip number 2, inspect the patient and their surroundings for any relevant medical paraphernalia, monitoring equipment, or walking aids. Check the patient's presentation, speech, and posture, and it's a good idea to shake the patient's hand when you introduce yourself to check for grip strength or neglect. And our last tip is to utilize a standardized template like Carepatron's Cranial Nerve Exam template to keep your notes organized. You can find our Cranial Nerve Exam template and many others from within Carepatron. Just head to your Carepatron app, select the templates from the menu on the left, and search by keyword Cranial Nerve Exam. If you found this video useful, be sure to like and subscribe to Carepatron's YouTube channel for more helpful content.